Today in Health Digest, we are looking at a different kind of development, one that involves the life of a child from infancy through to the first 2 or 3 years of their life. Despite autism spectrum disorder said to begin during prenatal life, most children do not get a diagnosis or get started on treatment until they're either 3 or 4 years of age. My name is Gloria Milimo, and I interrogate why.
Apple. Where's the apple? This is peach.
To the ordinary person, this may pass for any other playtime for a child his age. However, for 2-year-old baby Imani, such sessions are critical for his development.
Yay!
Imani was diagnosed with autism, a lifelong developmental disorder that impacts the way he communicates and how he sees the world around him. For those diagnosed with autism like Imani, occupational therapy plays a huge role in helping them develop various skills, as explained by occupational therapist Sanaipei Kimiti. She explains that an assessment of the patient is the first step that helps them determine the challenges the patient is facing.
What we were doing with Imani, it has been a journey. We've been working on concentration and attention span. Most children with autism have concentration issues, so they have a short concentration and attention span. They're also easily distracted, and they're not able to focus in an activity for so long. So the activities that we do, they have to be playful and interesting for the child. We did a number of activities, and when you're doing those activities, we were focusing on different areas. Like I said, concentration and attention span. We were also working on eye-hand coordination, like the activities we did of threading. You know, it involved both hands, the right and the left hand. So you have to hold the bead with one hand and the thread on the other hand, and thread the bead through the thread. So with that activity, it's help on bilateral use of hands. That is bilateral body coordination. And then when you're taking that bead, that thread through the little hole of a bead, you're also working on eye-hand coordination, because you have to look what you're doing for a child. So we are focusing on those activities, then you're working on concentration and attention span. Let's do it together.
Play is important for children whose attention and concentration span is minimal. In order for them to understand and master a skill, they often have to emulate what the therapist does during play.
When we did activities like puzzles, there are those that have some handles, you can hold it. So that one also work on fine motor activities. You know, you have to look at a shape of an object and the cutting of that object, and also put that one together. So that one also work on the eye-hand coordination, and then so the cognitive, and it's also help the child to relate. When we're doing all these, we are preparing the child to be independent in activities of daily livings.
Similarly, play is slowly helping improve Imani's outcome.
I can say that it has made a great change since we started. He's also yet to do speech therapy, but according to the therapist, she thinks there's potential for Imani to develop speech on his own without the speech therapy, and that is if we introduce him as early as possible to a play group, whereby he'll be around other kids and hear how they speak and what they do. It will fasten it, because as at now he has already started repeating what someone is saying, even in the house after the therapist is gone. When I tell him something, he repeats it. Now he sings, even the cartoon, you can kind of get which cartoon he's singing. It's no longer humming. He's trying to produce some words. He's more attentive now. Imani can sit down, we can eat, because another challenge was getting him to eat, to sit down so that we can have a meal. And also dressing him was becoming a problem. He wouldn't want to be held down to put on diapers and all that. But there's a great change. There's a great change since we started occupational therapy.
The speech, like the words, has really improved. He's now able to identify a few objects like car, animals. He's able to repeat, like when you're doing the flashcards and reading through the pictures, he's able to repeat, and he repeats most of the words. He's also able to sing along, action song, or the preschool songs that we normally sing that involve the part of the bodies, and he's able to do that. I remember there was a time when you're doing therapy and the mom is not here, so she had to send me a small clip of Imani singing, but because the words were not clear, so she could not understand, so I had to write her, what is she that Imani is singing, so at least he's able to pick up and relate the action. Even if the words are not clear, you'll see him doing the action and babbling something. So we need to put the words into the actions. His concentration has also improved. At least he's able to sit down and do an activity through, The tantrums have also reduced. He had a lot of tantrums of, shouting, kicking himself against the wall and crying. And this one also reduced with an understanding of speech, of communication. Most children with autism, because they're not able to express their needs, the expressive communication, or we are not able to understand them, they end up being frustrated. And it's not just for children with autism. I believe this is something happened for everybody, even for me and you. If you're trying to communicate something to someone and this someone seems not to understand what you want or just ignores you, then you'll become frustrated. And also because you don't know how to communicate, you'll end up they end up being destructive, probably harming themselves. They can kick themselves, hit their head, or just throw objects all over. So that one has also decreased. He's doing well.
So when you're not around, or maybe after the session, what are some of the activities that parents can engage in with their children?
For every session that we normally do, or rather for every child that I normally see, after the assessment, I normally give a home program. And this home program is what the parent or the caregiver need to continue with the child every time that I'm not around, or even when I'm here for an hour. You see, a day we have so much time, but at least to have an hour or 45 minutes of one-on-one session, like what we were doing. We can continue with beading, we can do things like coloring, we can do activities like throwing and catching a ball, and a number of activities. I normally give them a number of activities and how to go about it. And then there are outdoor activities that they can engage a child with.
Round and round, wheels on the bus go round and round, all through the house.
You see, what's working for Imani is that this form of intervention was started early due to the red flags his mother Faith Obote was able to pick in good time. For developmental pediatric specialists, this helps yield better outcomes for children.
The beauty about a child's brain is that the child can learn and grow. And so we're always looking at what a child's functioning looks like if they're moving through the different phases of childhood. So you'll find when a diagnosis is made before the age of 6 years of age and interventions have been made, these children have easier outcomes than those who are made when the child is older. But either way, whenever the diagnosis is made, what we do is each time the child comes in, we're looking at what their social communication functioning looks like. And you'll find that when they're entering into adolescence, some of these children get other mental health comorbidities like anxiety, depression, and there are a few who develop, like I said, epilepsy. And there are those who also become bipolar, but they're all are risk factors, but it doesn't happen for every child.
Since autism is a spectrum disorder, the extent to which a child is affected may vary, and this can be from the way they communicate, interact, or even learn. One of the factors that contribute to late diagnosis of the condition is said to be lack of awareness.
It was so frustrating not knowing what is happening with your child, or having to wonder, asking around what could be wrong, or this is not normal. I feel like my baby behaving this way is not normal. At the same time, here are people also telling you the opposite, that you are paranoid, that you are just a first-time mom. It could, children develop differently. People have different milestones. And among those people was the dad. He was not so vocal on the opposite, but he always kept assuring me that our baby was okay, which was fine, as he should, because he's the dad. But you see, for him now, taking such kind of news was not the same for me. For me, it was a relief. For him, it hit him hard.
By the time now we decided to go to the doctor, I think it was just to calm her nerves, okay? So she was raising these concerns, but on my end, I was like, no, he's okay. But you see, mother instincts are very different from the father's instincts. Probably, you might say it because of the amount of time they spent with the kid, probably. And so we decided to go to the doctor, and they did a test, and they diagnosed him with autism. It was a matter of confusion on my end, I might say. I was being positive about it, encouraging the mom about it, but on my end also it was a bit of you see, there's a way that children grow, and there's a way now you are told your baby is going to grow in this way. So this was a bit different for me, okay? I took it as a challenge. I'm an optimist, and I took it as a challenge, and I was like, okay, whichever, God doesn't give you something that you cannot handle. So we said, okay, sawa, so what can we do so that we can make him better? And so there were some of the ways that we were taking through. We were given articles to read. We were taken through also some sessions also with the Daktari. And it also happened that in my workplace, I have a colleague who is actually my manager, who also has gone through the same issue, okay, with their kids, and for her it's 2. And so I also sat with her, and she was so encouraging, and we talked, and the things that she told me, that these are things that is managed. It's a spectrum, and the good thing with Imani is we caught it early, and it didn't really go, the spectrum isn't so high, so it's easier. So when we started now the therapy early, we can see the changes.
Every day is a challenge for parents with a child with autism spectrum disorder. What happens in the brains of these children that doesn't allow them to be on a typical developmental trajectory can be overwhelming, especially for those who require constant care.
Yeah. There you go. What is that?
Sylvia Machabo, a mother of 3 who 2 of her sons have autism, knows the struggles too well. But at the end of the day, Machabo says she has to remain strong for her boys.
It's a learning journey that requires a lot of grit, a lot of patience, a lot of love, because there are days or moments when he wants something, we can't understand what he wants. So he gets frustrated. He starts having a meltdown, and sometimes you come from outside, you're dealing with everything else, and you still have to deal with it. And you have to compose yourself and remind yourself that he's special. So you have to have patience to try as much as you can to understand. Or there are days you're having a headache and he's screaming the roof down. That's the time you have to take a moment and try and figure out, was that Are we happy? Are we sad? Because it all sounds the same.
Experts say part of the diagnosis often involves linking parents or caregivers of children diagnosed with autism to psychologists to help prepare them for what lies ahead and for their own mental well-being.
For these families, the way we really work on empowering the caregiver, whether it's a mother and a father, we teach them how to, their coping strategies of when you're stressed, exhausted, and worried, who do you speak to? And so we have medical social workers and psychologists who we work with to help with the parent's mental health status, because that is very important, because a caregiver who's not feeling stable and competent tends to maybe go into denial where they are not even taking the child for therapy. So whenever we make the diagnosis, we always link them up with psychology services and even family support groups, because those are fundamental. Seeing another mother who is talking about her journey and how she helped her child are links that really help support the mental health status for these families.
Dr. Wamiti says there is a possibility of giving birth to a second or even third child with autism, and this reality can negatively affect any parent.
I'm in a support group where we have other moms who are doing this. And there was a time we were having such kind of a discussion, and a lot of women came out and said that they had second and even third borns who are also autistic. And it was from the way they were putting it, it was hard. It's not easy. I can imagine having what I'm experiencing with Imani, having to experience it with another or two even or three. So that put some fear in me a lot.
It is estimated that autism affects about 4% of the population. Even still, Kenya does not have updated data on the prevalence of this condition, something that child specialists attribute to children either being missed or misdiagnosed for just having delayed speech or having anxiety disorders. Having a standardized diagnostic criteria will help capture these cases early.
We have our something called the DSM-5 book, which is the 5th edition of the Diagnostic Statistical Manual for mental disorders, or that's what it's called. But we also have neurodevelopmental disorders in that book. And it has a diagnostic criteria where a child is having social communication deficits, and there are 3 categories that we look at for social communication deficits and social interaction problems.
For Machabo, founding the Underspeaks for Special Needs Persons Africa organization aims at according people with autism a dignified life despite their disability through advocacy.
It's not a death sentence when a child has autism. It's just that you just need to put them in the correct environment, give them the right early intervention. We are diagnosing at 7, 9. Other people are doing it at 2. And by the time they are 5, the children are well integrated. As we're setting policies, as we're setting support system, education, health, just have them in mind and give them the solutions that they need. Because you find even something as NHIF doesn't cover for us therapy. So what do we pay for? Unless we're in inpatient, what is it for? Just as you're talking universal healthcare, let it be universal. And universal in the terms that you meet me at my point of need. Not what you think, but my point of need. So consider me as a parent. When I'm ticking and I'm saying this is a disability we have in the family, then give me solutions that will aid in making my child's life better.
She explains that awareness about the condition will also help end the stigma associated with autism. This stigma is often felt by the parent when the child experiences a meltdown or throws a tantrum in the public. This often happens when they have difficulty filtering sensory information that makes it hard for them to make sense of their environment. This can be overwhelming and even uncomfortable. Being a parent to a child with special needs can push one to a breaking point. But for Faith Obote, understanding her son's needs has given her the strength to push on in a bid to better his future. Gloria Milimu, KTN News.